The Swedish outlier. Sweden was the only country here in Europe this year that did not implement a nationwide lockdown to stem the spread of the coronavirus. The approach has been controversial because Sweden's per capita death rate is higher than its Nordic neighbors. Tonight, infections are on the rise in Sweden, and restrictions are finally being imposed.
It's November, one of the darkest months of the year, and this darkness is unfortunately going to get worse. We're heading for darker times with the rise in infections. The same goes for the world, for Europe, and for Sweden. All of the indicators point in the wrong direction. The infection is spreading quickly.
Well, Belgium has one of the world's highest COVID-19 death rates. A sharp increase in new cases has forced the government to reimpose a partial lockdown. And as DW correspondent Terry Schultz reports, the rules are being rigorously enforced.
Time's up for coronavirus rule breakers in Belgium. The warnings didn't work to convince people to wear masks, limit gatherings to 4 people, and obey the evening curfew. So the next step is strict enforcement by police inspectors like M. Lacroix and Kester Uiterburg. They've become the Belgian authorities' last line of defense against the sky-high infection rate. Their weapon? A €250 fine.
Bonjour, vous voulez faire le masque? Oui, excusez-moi. Si vous fumez. Vous avez une carte d'identité, monsieur? Oui.
Their orders are to accept few excuses.
Will he get a fine?
Yes. So he was not wearing his mask while we are passing there, so...
It's a lot of money for somebody their age.
Yes, but everybody knows the rules. It's the same for everyone. It's not for us to judge he's able to pay it or not, so it's not our business.
Their business is to make sure that what the Prime Minister has called the last chance to get control of the virus isn't wasted.
The fear of having a ticket, of having a fine, is gonna stop some people from committing infractions, of course. And then we hope that the behaviors that we are enforcing are indeed stopping the disease.
There's one area where officers are being more tolerant now than during the first wave of the pandemic. That's for people who can't stay home because they don't have one. During the last lockdown, many of them received fines. Plainclothes officer Chris van der Houte is in a special police unit designed to help get people off the streets. He and his colleagues asked the Corona patrols to take it easy on the homeless this time around.
The ideal scenario that would be that we have place and shelter for everybody, but we're not in that situation for the moment. We have to be a little bit flexible for those people and more working like sensibilize them to wear the mask, to keep their distance, but they're part of the street, so they're in the streets.
As a last resort, those who must or want to stay outside can now get a document to show the police and avoid a penalty. But van der Houte agrees that for the rest of the population, the tough approach is unfortunately necessary.
But when you have people who doesn't want to listen and always make like the same mistakes, yeah, you have to give them a fine, you know, they have to feel it somewhere.
Hundreds of those €250 infractions are still being issued every week, according to the Brussels police. On this night, however, by the 10 p.m. curfew, downtown is deserted. The officers say they hope this means people finally comprehend just how bad the corona situation is.
If everybody saw what's happening really in Brussels or in the hospitals, maybe people will take it more seriously and respect all the rules.
The government's strategy seems to be working. Since the reinforced measures took effect, Belgium is no longer in first place for the worst rate of new infections in Europe.
More on COVID-19 now. Turkey is one of many countries seeing a big increase in the number of new infections. But as in other places, many are letting their guard down, despite pressure from officials to stick to the rules. But opposition politicians accuse the government of hiding the true scale of the outbreak, as DW's Julia Hahn reports from Istanbul.
The city of 16 million, in which the coronavirus is spreading. And one of the teams that are fighting to stop it. Gülgün Emircan is a dentist. At least she was, until the pandemic started. She's been a contact tracer since March, one of around 35,000 in Turkey. Seen from here, the size of the city can be scary, and I sometimes wonder where this pandemic is headed. But as a doctor, I have a responsibility. I try to think positively, and knowing that I help people is what motivates me and keeps me going. A tracing team manages around 10 house calls a day. They work in shifts almost around the clock. The goal is always the same: track down, test and isolate those who've been exposed to someone with COVID-19. And all of this as quickly as possible. Gülgün's first case today is the Kulaksesolo family. The mother recently tested positive. Now the father has symptoms too. If the test is positive, Gülgün will also try to trace his contacts. The whole family has to stay at home for the next 14 days. After each visit, protective clothing has to be changed. Gülgün's job is time-consuming and strenuous, but it's worth it, she says.
Few countries expanded their contact tracing capacity to the extent Turkey did. These teams were key to slowing the spread of the virus in spring, health officials say. But now, like elsewhere in Europe, the number of infections here is on the rise again.
As in many other countries, people's vigilance here has slackened. In a recent survey, more than half of the respondents in Turkey said the coronavirus does not affect or worry them. And critics also blame the government for this lack of concern, because the health ministry no longer reports the number of new infections every day, but only the number of symptomatic patients. Canan Kaftancıoğlu of the opposition CHP says the government is hiding the real scope of the pandemic. Here in Istanbul alone, the number of cases is 20 times higher than the tally from the Ministry of Health. I'm saying this with regret, but the figures and information we are given are not correct. Gülgün Emircan is on her next house call. She does not want to take part in political discussions. She knows the debate about the numbers, but doesn't want to get involved. That more and more people disregard the coronavirus rules frustrates her. It makes me sad. We're putting so much effort into this work. But what's the point if so many act as if nothing can happen to them? And if this doesn't change, we won't see an end to this pandemic. Gülgün hopes that she will soon be able to work as a dentist again. But she also knows that her new job will be needed for quite a while.
I'm joined now by Dr. Emanuel Copa-Bianco. He's Director of Health at the International Federation of Red Cross and Red Crescent Societies. Dr. Copa-Bianco, thanks for talking to Deutsche Welle. Contact tracing was seen as a key factor to contain the virus earlier in the year. Many countries did a good job of expanding their capacity, as we just saw there in Turkey, but now numbers are on the rise again. Is contact tracing just not working?
Contact tracing remains key to stop the epidemic, and it always needs to be looked with testing and isolation and quarantine. What happens when the numbers are going up so fast and the cases are so large is that the system is simply not functioning well anymore. That doesn't mean that contact tracing or testing is not important. It's that we need to bring down the numbers and then step up even further contact tracing and testing capacity in the countries.
What do you say then to those who claim that measures like contact tracing are hurting the foundations of democracy?
I totally disagree. I think contact tracing is key to stop the epidemic. Of course, it needs to be done with the absolute protection of the data and information of people, and that's why it's very important that this is done by professionals or people that are very well trained. But if we want to break this chain, like in any other epidemics, contact tracing, like testing, like isolation and quarantine, are critical tools that we cannot do away with.
Well, let's move on to the vaccine, which has raised hopes in recent news. The EU has agreed to buy 300 million doses of the vaccine. Will we see an even distribution among countries?
Well, there's been a lot of efforts to put in place systems to ensure equal distribution. It's unlikely that we'll see that happening. We need to continue advocating. That's what the Red Cross does, for that to happen within countries, so that the people who are particularly at risk have it first, and also across countries in the world, to make sure that the low-income countries, the fragile settings, are not forgotten, and the people in those countries are not the last to receive it. And it's a big political fight that we all need to really go into to ensure that people have access to vaccine in an equal way.
Indeed. In a recent interview, you said, we ask governments to act with speed, courage and inclusiveness. What do you mean by that?
Speed, because when the numbers are rising so fast, we need to move fast. You need to put the measures in place rapidly as lockdown measures, and the faster you are, the more effective these measures are. Inclusiveness, because you really need to take care of the most fragile ones, and not only for the virus, also the most fragile ones, the most vulnerable ones from an economic point of view. And the systems of social protection, of support for the categories of people that are without work at the moment is just as important as the physical protection for the people who are going to get sick. And so that is what we are really asking for: speed and inclusiveness at all levels in the societies.
Right, Emmanuel Capobianco, Director of Health, International Federation of Red Cross and Red Crescent Societies. Thank you very much.
Thank you.
Well, France is also fighting to control a second wave of COVID-19. Daily infection numbers are the highest in Europe. And yet the lockdown France imposed is less strict than during the first wave. The government is trying to strike a balance between protecting health and preserving the economy. But not everybody is happy about that approach. DW's Lisa Lewis reports from Paris.
Even under lockdown, the French are taking to the streets. As opposed to during the first COVID-19 wave, schools here are staying open. But teachers don't feel safe. We have between 20 and 25 pupils per class. We are trying to impose social distancing, but in our classrooms we can at most have a distance of 40 centimeters between each pupil.
On attendait justement ces mesures sanitaires renforcées.
We were hoping the government would reinforce sanitary measures, but they haven't, or at least not sufficiently so. We don't understand that. We feel the government is abandoning us.
On a l'impression qu'on est lâché.
They are getting support from their pupils who have been blocking school entrances and posting videos online that show a lack of social distancing. Also, unlike during the first COVID-19 wave, more shops are open and large parts of France's industry are still up and running. And yet, this is still one of Europe's strictest lockdowns, with people only allowed out 1 hour a day and only within a radius of 1 kilometre of their homes. Most French think the government was right to confine them, but many criticize the method. I don't understand why big supermarkets are no longer allowed to sell books, clothes or toys. Just because small shops that sell the same things are closed, the government is just not good at explaining itself. This will cause lots of unemployment and bankruptcies. Why are they leaving big supermarkets open but closing smaller shops? Megastores often take in hundreds of clients and small shops only 1 or 2. They are much safer. And yet the government is staying the course, even though the spread of the epidemic has been slowing down.
Dans ce contexte, de premiers signaux indiquent.
We are seeing first indications that the measures are producing an effect. But it is too early to lift restrictions. The situation is still very grave and the epidemic is continuing to gain ground.
Continue de gagner du terrain.
The number of people in intensive care is still going up, with more than 93% of ICU beds now occupied by COVID-19 patients. The government says hospitals could reach the breaking point sometime next week. And many people here fear now they might have to spend Christmas under lockdown.
Let's take a look at some other developments in the pandemic. Germany has recorded nearly 22,000 new coronavirus cases in the last 24 hours. Well, the death toll in the UK has passed 50,000. That's higher than any other European country. New restrictions have been announced in New York. Restaurants, bars and gyms will have to close at 10 p.m. and private gatherings are now limited to 10 people. And the organisers of the Tokyo Olympics next year say athletes won't be required to isolate for 14 days. The Games have already been delayed by a year.
The recent news of a potential breakthrough in the search for a coronavirus vaccine couldn't come soon enough. Recorded cases in Africa are nearing 2 million, with the infection rate accelerating in some countries. Kenya has reported its highest daily death toll from COVID-19, with 24 people succumbing to the virus. Now, this number pales in comparison to other parts of the world, but the increasing number of deaths comes as the rate of new infections spikes across the country, mostly in Nairobi and Mombasa.
The number of people infected with the coronavirus in Kenya is sharply rising. It's a worrying trend in a nation where intensive care beds are in short supply. Authorities have started scaling up the country's testing capacity, reporting more than 1,300 new infections on Tuesday.
Without a vaccine and without any cure in sight, we'll probably be looking at multiple peaks over the next coming months.
Kenya's government brought back restrictions last week. These include an overnight curfew from 10 p.m, and bars and restaurants have been ordered to close by 9 p.m.
Unlike the first wave, where people are more, worried about this thing, and they're also more cautious, with the second wave, people drop their guards down. So as a result, you find the numbers surging.
The race against time has now resumed for Kenya to suppress the spread of the virus and avoid overwhelming its health facilities.
My first guest today is Professor Anzala. He's from the Department of Medical Microbiology at the University of Nairobi. He specialises on infectious diseases. Welcome to DW News Africa. Professor, so on Tuesday, Kenya reported its highest death toll since March, and cases in the country are also spiking. Why is this happening now?
Yeah, I think when we first got the first case way back in March, and then we prepared very well for, the outbreak, and we started the response in terms of putting in measures, some restrictions in Nairobi and Mombasa, travel restrictions and curfews, and then risk communication. I think what we didn't do very well, we really didn't communicate very well that this outbreak was going to take a long time. So people started by social distancing, people went on to wearing masks, people went on to sanitation and hygiene, but with time, fatigue has set in. And there's a lot of fatigue from healthcare professionals, fatigue from the general public, such that the epidemic is actually taking longer than anybody had expected. And that's really where the problems are. That's where we are beginning to see a spike in infections.
I'll point out to our viewers that you did have a mask on just before we came off air. But that, Professor, and other measures that the government has now recently reimposed, perhaps, do you reckon that that would be enough to curtail the spread of the virus?
Yeah, those measures are actually the most we can do, because what we are trying to do is, I sit on the COVID task force that is advising government, and our approach is to really balance between interest in ensuring that life goes on to some extent in terms of commerce and industry, but at the same time we limit the spread of COVID. So really what we have put in place are measures that are still non-pharmaceutical, but really at the end of it all, it boils down to individual responsibility. The curfew is still on to some extent from 10 o'clock, 10 p.m. to 5 in the morning. We are not allowing people to move around without masks.
Professor, sorry, I must interrupt you because
we are restricting, gatherings. But this boils down to individual measures, really. There is nothing more that the government can do more than this.
Okay, all right. Professor, thank you so much. I did have one more question for you. If you can answer this one very quickly. There's been news now about a soon-coming virus. What do you make of that?
The vaccine, that is.
Vaccine, sorry.
Yes, the vaccine. No, that is a game changer. For us, that is a major welcome. What we also want is African countries to be involved. For now, there are only 2 African countries that are testing these vaccines. That is South Africa and Kenya. That started last week. But we want to see more African involvement so that when these vaccines are pronounced to work, then they will not only be working in North America and Europe, but they will have also been shown that they are efficacious in a multiplicity of African countries.
Okay, fantastic. Thank you so much, Professor Omu Anzala, joining us from Nairobi. Thank you, Professor.